7 minutes to our new polls, but first some verbal fistfights breaking out on Capitol Hill as the health care battle goes into its final round. One Republican going right after House Speaker Nancy Pelosi today. Take a listen.
I have three simple questions for Ms. Pelosi. Are you so arrogant that you think you know what's best for the American people? Are you so ignorant that you are oblivious to the wishes of the American people? And are you so incompetent that you're going to ignore the Constitution of the United States, use tricks, deceptions, bald-faced lies to try to ram down the throat of the American people something that they do not want, and it's going to be absolutely worse for their health care?
Whoa. Joining me now, Fox News contributor Rick Santorum, a former Pennsylvania senator. All right, Senator, so arrogant, ignorant, bold-faced lies, incompetent. The rhetoric is pretty strong right now.
Yeah, I know Paul. He's a physician and is a good guy, and he cares deeply about his profession. And I think a lot of folks, not just in the profession but around this country, are seeing this arrogance, and they just don't understand how overwhelming majorities of the American public don't want this thing. The Speaker of the House has got everybody on lockdown over here. I'm going to ask this question: why are they voting on Saturday and Sunday? Because they don't want their members to go home. They're going to keep them busy here through the weekend. Even if they can't vote Sunday, they're not going to let them go home because they don't want them to talk to the folks back home or see them. They're going to try to convince them that they know best. And that's what's got everybody upset around here. It's just this attitude that we've figured out what we want to do, and the hell with what the American people think. They think that
the American people have been poisoned on what is a good bill by bad coverage of it.
Yeah, well, the reason they think that is because they have some polls that say that people like a provision that says people who have pre-existing conditions, shouldn't be banned from insurance, or they like the idea that more people are going to get, help from the government to buy their insurance. Sure, if you pick out a couple of things in the bill that are popular, yeah, you can find that. The problem is, if you look at the whole bill, you look at how it's paid for, you look at how it's going to be implemented, and who's going to control the, what kind of insurance you get, and what doctors you can see, and what hospitals. Those are the things that people don't like, and that's actually part of the bill, and they don't like that more than they like the things that the Democrats are trying to say that people don't understand.
All right, I have a challenge for you. We had Jim Angle on at the top of the show. We tried to understand what's happening with this CBO report and the numbers and why it's controversial. Yeah. Can you bottom line this for us?
Yeah, a couple of things. Number one is a lot of the things that they say they're going to do to save money, for example, the Medicare cuts and the increases in taxes. Let's take the increase in tax. There's a Cadillac tax on health plans that goes into effect 8 years from now. Well, if they can't put the tax in now because they don't have the political will to do it, and they actually are passing good things to offset it, are they going to be able, 8 years from now, to actually implement this tax? The answer is no. 8 years from now, the future Congress, it's going to be on their watch that this tax is going to go into place. They're not going to let this go in. They're going to put it off. So it's a phony tax. It won't ever happen, in my opinion. Secondly, Medicare cuts. You may be familiar, and your listeners may be familiar with something called the doctor fix, which is a $250 billion piece of legislation that's not in this bill. They took it out. It's not in this bill to pay doctors. But if we didn't do this, doctors' reimbursements would be cut 22% under Medicare. Where did this come from? It came from a 1997 Medicare reform bill, which put into place this formula, which was scored by CBO to save all this money. Guess what happened? We didn't save it. Why? Because we never implemented the formula. Why? Because if we did, doctors would leave Medicare. There are cuts in this bill that if we implement them, doctors and hospitals will leave Medicare. It will never get done, and it'll be just more expensive. That's really the issue here. Things that are promised that will happen. And CBO says, if you do this, you'll save money. The point is, future Congresses won't do it.
I actually think I get it now. All right.